And we get to continue right now. I am pleased to be having a doctor with us on set that will be letting us in on all matters cervical cancer. That is Dr. Wachira Murage, who is an obstetrician gynecologist. Welcome to the show.
Thank you. Thank you, Vivian. And Happy New Year.
Happy New Year. It's a pleasure to have you back on the show. Let's get into matters cervical cancer as we just work towards spreading the awareness on it. Let's begin with what exactly cervical cancer is and maybe how it develops.
Thank you. Thank you so much. Cervical cancer is a cancer involving, it's a malignancy, so it's a cancer involving the lowermost part of the uterus, which is called the cervix. And that area is the entrance from the vaginal cavity. Just before you get to the uterus, that organ there called the cervix, that is where cancer of the cervix develops. And it's a slow process cancer that develops over quite a number of years. Let's say about 10 to 15 years. 10 to 15 so if I isolate one cell that is going to be cancer of the cervix, it takes about 10 to 15 years to become cancer. And this is why we always insist on screening, regular screening, because you're able to catch that cancer that develops from that area, taking a long time, being influenced by various factors, among them sexuality and other viral infections that now transform it, and then it becomes cancer of the cervix. Yes.
Yeah, so that, are there specific causes of it? You mentioned sexuality, but are there specific causes that can be pointed out as this is the cause of cervical cancer?
We are lucky because cancer of the cervix is one of the cancers that we almost over 90% know the causes. And the cause basically is normally human papilloma virus. And when you're looking at cancer of the cervix, because there could be other factors, maybe amounting to about, say, about 10 to 5%. But HPV, which is sexually transmitted, is what we now know is cause of the cancer of the cervix. In fact, we kind of classifying cancer of the cervix as a sexually transmitted cancer because of the HPV. So we are looking at now other factors, now things like sexuality now. We're looking at, the age of starting sexuality, the number of partners, and other alternative sexual practices. All those now are considered to be risk factors for the causation of cancer of the cervix. And that's why you find now you have even very young patients that are coming up with the cancer of the cervix, depending on the onset of sexuality and the number of partners that they've been able to engage in. That now becomes a sigmost factor when you're thinking about the causes of cancer of the cervix.
Okay. So does it mean that now the males are the carriers of it, or how is it? What is the involvement with sex and cervical cancer?
Yes, the males now become, when they have now that virus, then they transmit it as a sexually transmitted infection. So when they do that and they transmit it to the ladies, and then it starts now to destroy the cell. From one cell, replicates, just like we said, one cell replicates into another one, then they colonize most of the cells at the cervix, and therefore now it takes over as cancer of the cervix. So males now will be the carriers, they'll transmit the HPV as an STI, as a sexually transmitted infection to the lady, and then it will destroy. Of course, we have so many HPV viruses, and therefore now we have what we call the high risk subtypes of HPV. Among them 16, 18, 31. So those ones are now, and others are now known to be now the high risk, because there are others that cause things like the warts, and other viral infections. But now there are those high risk factors. When we isolate those ones, then we become a bit more vigilant when you're trying to follow up those patients with those high risk HPV types.
I know there's the HPV vaccine. We'll get into that because cancer of the cervix is one of the cancers that can be prevented because there's a vaccine for it. But let's talk about the early signs. How can one tell that probably I might be having cervical cancer? What are the early signs that one can look out for?
Just like cancers, and I think it's important for us, even as the listeners out there who are listening to us, to know that cancer of the cervix is very, very common in this country. We are having about 35 people per 100,000, 35 women per about 100,000 women, having cancer of the cervix. And it causes about, close to 3,500 deaths per year. So it's important that we take cognizance of the fact that cancer of the cervix is now overtaking many other cancers. Coming back, Vivian, to your question about what would be the early signs, most of the time when it is developing, it is symptomless. You don't feel anything. Then sometimes people may start complaining of some low back pains and pelvic pains. Others now, as it progresses, they start saying, oh, sometimes I see some foul-smelling vaginal discharge, and sometimes it may have some blood stains, the vaginal discharge. Others, of course, now you start saying, okay, I do get irregular sort of menses, bleeding between periods. And when I engage sexually, then I get some spotting, what we call post-coital bleeding or spotting. Because at that particular time, when the cancer is touched, then it tends to bleed. So there's that abnormal bleeding. Then, of course, I say the foul-smelling discharge. And, of course, now there is the pain that may come with it. But abnormal bleeding, abnormal vaginal discharge, especially blood stains, are the telltale signs of cancer of the cervix.
When it comes to screening, who is supposed to go for screening? By who I mean, at what age should we start going for the cervical cancer screening?
What we normally say is that anyone who has been sexually active, whether once or whatever number of times, as long as one now has engaged sexually, then they are amenable for screening of cancer of the cervix. So we don't, and this goes even up to in menopause. Yes, it's a bit slow in menopause, but we say that cancer of the cervix grows slowly. And therefore, if one is in menopause, they are 50, maybe they are 60 or 65, and maybe they started developing their cancer at age 50 or something, then it may get them at that age. So even in menopause, it is good to be doing regular checkup, at least every 3 years, to be doing at least a checkup, either the VIR or the pap smear or the HPV DNA.
Every 3 years at
every
least.
3 years. But now what you're advocating is every 2 years. And if one does a number of times every 2 years, then they can, of course, now jump into every 3 years. But that regularity is what we are calling upon women. As long as they're sexually active, even if they were sexually active, then they stopped, then they are amenable for screening to that particular duration. Every 2 years is what we recommend.
Let's talk about the prevention, because as we mentioned, this is a cancer that can be prevented completely. So there's a vaccine. You can be vaccinated against, HPV. So let's talk about the vaccine.
Yes. Of course, generally, when you're talking about prevention of cancer of the cervix, before we even go to the vaccine, we are talking about knowing that it is sexually transmitted, and therefore behavioral kind of approach is very, very important. To know that it comes from, from sexuality, and more issues of multiple partners, and starting sexuality early, and all those other things that go with the behavior. Be it things like hack, be it, all those things. Therefore, protective sex is very, very important. And that kind of behavior, when it comes to that approach, becomes very, very very key in prevention of cancer of the cervix. When you're talking about the vaccination, and it's good to mention that it works. Whatever may go around the vaccination, the politics and what people say, studies done, clinical trials done all over the world shows that the vaccine works. It prevents causation of cancer of the cervix. And who should get this vaccination? Best is before the onset of sexuality. And that's why you find, like, the government would say by age 10, all our young girls And indeed boys, because we tend to forget the boys. It's only that not so much emphasis, because the HPV can also cause things like cancer of the penis in the young boys. Yeah, so they should also be vaccinated. But I know we're more or less speaking about the girls.
The ladies, yeah.
Yeah, so age 10 is a very, very important age before the onset of sexuality, because studies done, Kenya Demographic Service, done earlier, the health survey, had pointed out that our girls are starting sexuality quite early, by age 12. They're already indulging, and therefore that is now the particular age, 9, 10 years. And it's indeed the government has done a very good job. It's going on in schools, and they are getting. So that one is important. But it is important to mention that time it's very, very effective. Of course, the effectivity reduces when the vaccination is given after the onset of sexuality. Okay. But any lady, whether sexually active or not sexually active, can get the vaccination. And why is it important even after the onset of sexuality? It is because the HPV types are so many. So a lady could have gotten maybe a portion of some of the types and maybe not others. The vaccination, you're not helping the ones that have already gotten into the lady. But the ones that they have not gotten, then the vaccination comes in handy to prevent the onset of those viruses.
Yeah. I don't know if this is still ongoing, but there was a time when the vaccination, the HPV vaccination for the younger girls was free of charge. So is it still free? Is there a cost to it right now?
It is free. The government facilities is a free vaccination. It's even done in schools now. Yeah, the ministry is ensuring that even in schools it's going on. So it's free. Of course, in the private sector, it's it's chargeable, but it is free in the government clinics. And the young girls can get it's recommended age 9, 10, even up to around 12 before the onset. We are trying to catch them before the onset of sexuality. Yeah, but even thereafter, whenever they are available, they can still get the vaccination. It's only that the effectiveness declines, when sexuality has started.
Okay. Yeah. Okay. So for every young girl, small girl out here, the parents can easily just take them to any public facility for the vaccine. For the vaccine. All right. That is well noted. Yes. So why is it still an issue? Why is still cervical cancer an issue in this region and in the country, to be specific, despite it having, a preventable measure? Is it that we are not aware that there's the vaccine, or why is it an issue? Because as you mentioned earlier, the numbers are going higher. 35 people per 100,000 that you had mentioned, and we can easily take it to 0. So why are we not yet there?
Okay, there's so many factors, and one of the things we would want to call out to our parents, the parents of these girls, is to take them for vaccination, because there's lots of politics about the vaccination. And what you realize is that when those teams come, the Ministry of Health teams come to the schools, many parents decline. Because they have to feel a consent. They have to say they consent for the young girls, because of course they're under 18. They have to feel consent, but most of the parents refuse. And we would call upon at this juncture to encourage the parents to allow those girls to undergo the vaccination, because the vaccination helps to prevent cancer of the cervix in the long run. Yeah. Of course, there'll be other things like pap smears and all, but of course it's a very, very good way and very, very proven way scientifically to prevent cancer of the cervix. Back to your question, it's a multifactorial question to say why is it that, yes, you're still having cases of cancer of the cervix, you're increasing despite having the vaccination free. One of the things is that the politics. You remember there was some bit of politics, involving the church and, all those other organizations that were talking about the cancer of the cervix having many problems. Like number one, people are saying, the girls are being sterilized, so they'll not have children. We would call upon people and various organizations to at least help people understand that just like other vaccinations, this vaccination, the HPV vaccination helps to save lives. It has no those side effects that are being talked about. I know many people would talk about, I know even doctors who discuss it, but it is proven. And the science is there to back the vaccination, and it helps. But of course now, because of the people are talking, the influences, there was a lot of fear put in the parents, and they were not sure what's I mean, yeah. It's good to say that it doesn't have, it may have some side effects like maybe itchiness, fever and such things. Some people may have allergy against proteins. And when you have allergy with proteins, then you may scratch here and there. But overall, it does not have those other side effects that were being talked about, like sterilizing. It was being said we are sterilizing our girls so they don't have children. I mean, we know we have ladies who have had the vaccination and they have children. Yeah, so it is that wave of people talking so much about the vaccination and people being selfish and all those things that really stigmatized the vaccination. But the vaccination works.
But then why all this politics around it? As you mentioned, it is effective, it works.
Yes.
So why do we still have people who are against it and, talking about it's used to sterilize the girls? Why do you think there's that politics around it? It's a good thing, so why is there politics around it?
I would say it's not clear, but I would also say that, it really serves selfish. People are just selfish, I do think, and they want to prove a point, and some were even sponsored, I think, by, drug companies. There's a lot of infights with the drug companies because the various vaccinations, there are various types of those vaccinations from different companies, so there were wars against this, and I think some people are never paid. And of course, there was the issue of the church, members and some different faith and beliefs. Yeah, there were all those mixture of things. It never came out clear why there was this fight, but it was very clear that, different faiths were trying to bring in their own things, their selfishness, and of course there was that fight of the drug the multinationals, trying to compete against which one is best and that and all those things. Yeah.
So you are assuring us of its effectiveness.
Yes, it works. That one I can vouch that the vaccination for HPV prevents death, saves lives, and reduces the mortality and the morbidity of the cancer of the cervix. And does not cause fatality because you have girls that had it and they have children and they're happily married and they had the vaccination. And people are continuing to embrace, this vaccination, young women in families, and they're having children and they don't have any big problem. So it works.
All right. So for any lady who's watching us right now and would love to get the vaccine, you mentioned it doesn't, the age doesn't matter. Even if you're 50, you can just go get the vaccine and it would still work for you.
It will still work, but let's encourage the mothers, the young girls, before the onset of sexuality. That's the best time it works because it will kind of cover most of them. When you're already engaged sexually, you may contract some viruses, and therefore those ones that one gets will not be protected against by the vaccination. So it's better early, but generally all women are amenable for the vaccination.
Okay. There's the question on, I know you've already told us how one can get the cervical cancer, but there's always the question of hereditary. Say my grandmother had it, am I at a higher risk of getting it, or is it just purely sexually transmitted?
Yes, cancer of the cervix is largely, HPV related. So hereditary, really, it's not a major factor here. Yeah, in medicine you don't say never, because of course there is the immunity makeup of a person. How do they resist diseases? If it is that viral infection, the HPV, how can they resist? So there's a genetic makeup of people. So you can't fail to mention at the end of the list when you're talking about the behavior, sexuality, the HPV and all, you can't fail to mention hereditary at the end of the list. Okay. But largely, sexuality and HPV is the major cause of cancer of the cervix.
All right.
Yeah.
Okay, let's talk about now for those who have this condition or disease, how to go about their treatment options.
Yes. Yeah. Treatment option, of course, starts from history. So when we have a patient with all this symptomatology and we do think they may have cancer of the cervix, and normally what we do is that we normally start with examination, all right, and via villi, which again is available, because pap smear may be a little bit expensive, but via villi. And you want to encourage the listeners, wherever they are, the health centers, those hospitals near you are able to do via villi, and it is almost as effective as pap smear. Then they're able to refer you for a pap smear if the via villi is suggestive of cancer of the cervix. So once you make a diagnosis, then there is the issue of making the diagnosis by histology. So we will normally examine the patient, and if we get a lesion, then we get a piece of that. So we do what is called EUA staging and biopsy. EUA is examination under anesthesia, because you want to see, you've already seen a lesion, okay? And that lesion, you need to get a piece of tissue from there, and then you take it. Then you assess what is the growth, how does it grow, because cancer of the cervix is staged. Stage 1, 2, 3, 4. Of course, there's A and B, depending on the lateral, the way it spreads, either horizontally or going up, is the way it is staged A and B. But you're talking about stage 1, 2, 3. Stage 1, basically, in simple terms, is just within the cervix. Stage 2, it has moved out of the cervix a bit. Stage 3, it has gone to the bladder and going up to near the kidney, the ureters. And then stage 4, it has gone to the tissues around, the what you call the peritoneum around. It can go to other areas. Okay, that is now stage 4. So once you have now made the staging, then you can be able now to say, how do I plan my treatment? Stage 1, basically up to stage 2A, that one surgery can be done. Surgery followed by radiotherapy and chemo. But from stage 2B going onwards, you cannot operate, because you cannot get the extent of the cancer. You may probably do surgery to a certain margin, and maybe the cancer has gone beyond that margin. So those ones, you need better and wider coverage. And therefore now you use chemotherapy, that is the drugs, and then you can use radio, because you now map out and you're able to irradiate a certain large area for that. There are other people who we do get that have very, very early cancer. For example, you may get a girl of 22, 24 years, and they have a very early cancer, what we call carcinoma in situ. The cancer is just localized. There are some few cells that are growing into cancer. Of course, the ultimate is surgery, but sometimes we may do a localized surgery that may attempt to remove the bigger portion. Yeah, so there are things like now cone biopsy. Yeah, you can have things like using very ice, it's called cryotherapy. So you can remove, and then of course you can cut a portion, it's called LETs, you can cut a portion of that area, and then you follow up. So there are all those recommendations. But cancer of the cervix, that's why we really insisting on that screening and follow-up. Largely stage 1 is almost 100% curable. Okay. You can actually cure it if you get it early. So there are all those now, the cauterization, you can have that, cryosurgery for early lesions. Early lesions, you can do that. You have cone biopsy, and then of course you can do LETs, you can just cut a piece of that area, and then you monitor using the HPV DNA. You can monitor using the pap smear. But the earlier you get the cancer, the better, even in terms of survival rates. Because as you say, generally cancer, we talk about prognosis. You don't talk about curing. Although we are saying stage 1, you can cure, but generally cancer, you talk of prognosis. And the earlier the stage, the better the survival rate. Yeah.
There's the question on whether it affects fertility.
Yes, cancer of the cervix can affect fertility because, of course, if there's a lesion there, things like, sexuality will not happen. Of course, it will cause infection. It will even block the cervix. But when you're talking about fertility, you're talking of other things like infection, tubal blockage, ovulation, hormones. As opposed to cancer of the cervix. But cancer of the cervix, yes, it contributes to infertility.
Yeah. You were talking about, whether it's curable or not curable. Most times when someone is diagnosed with cancer, sometimes we look at it as a death sentence.
Yes.
And that has been the case for the longest time. When someone says they have cancer, if it's a family member, you're already worried because you think, oh, now, how long are they going to live? What's the time, the time frame they will be on Earth and all of that. But I would love for you to just speak on it being curable, or the curability, if there's that word, how curable it is and how manageable it is for you to be able to also still lead a long life.
So we look at prognosis, and prognosis is what is the survival rate, kind of, in layman terms, the survival rate.
Okay.
So you're talking about now, like, and I know there's this thing about, our country and generally about cancer. You hear people talking about, oh, he was given only 6 months to live, he was only given 1 year to live, and those kind of things, 2 weeks. We have heard so many stories like those ones. But it all has to do with the staging. So stage 1, you can have even 90 to 100 people surviving. Then it comes down. When you're talking about stage 2, then you come down and you're talking about maybe 70 to 85. When you're talking now stage 3, you're talking now about 50. And this one is about 5-year survival rate. Yeah, 5-year survival rate. So stage 3, you're talking about 50% may get to 5 years. When you're talking about stage 4, then you're coming down and saying about maybe less than 40% or 30% will not survive the 5 years. Yes, because there is a treatment, then they are treated, then you find that now it reoccurs. And normally when cancer of the cervix reoccurs, it comes with a bang, because it has gone to the next stage. So if it was stage 3, now you find it has come up, now it has spread to other areas. You cannot now do a lot of things. Most of the time you use chemotherapy and occasionally radiotherapy, but chemotherapy is the commonest modality that is used when it heads to recur. And then of course now it has gone to other areas. It has changed from the lower staging to the other staging, and therefore now it reduces. Yeah, but generally that is now how you can talk about the survival rate.
Yeah. Speaking about reoccurrence, what is the reoccurring rate? Is it something that it normally happens? What's the rate of reoccurring?
It happens quite a lot, and especially stage 3 and 4, you will find that most of those cancers, almost to about 70% will recur within the 5 years. You find it recurring and to require more aggressive treatment. Sometimes it may recur and it comes to and recurs and it's more localized. So sometimes the doctors may decide to do a bit of surgery, just to debulk, to remove that, because you see, once the cancer forms a focus, it is that from that focus now it spreads to other areas. So if it recurs, then you can decide to do sort of a surgery, remove that focus, and then give things like chemotherapy. But the recurring is normally not a good sign. It's normally not a good thing, because it shows now the cancer now has come, and when it comes with a lot of force. But yes, stage 3 and 4, the rate of recurrence is quite high.
So for someone who had, say, I'm just looking at a scenario, right? For someone who had stage 1 cancer, got to go through the treatment option that is available for that, was healed from that, would you advise them to get the vaccine to avoid reoccurring or recurring, or
No,
Would that help?
the vaccine may not be amenable.
Okay.
Yeah, because you already now have the cancer.
Okay.
Yeah, so the vaccine will not help. So no matter what we just look out for is the recurrence, is now the follow-up and close follow-up. Of course, we have other people whose recurrence is very high, like people with disease like HIV, yeah, other, immune-reducing conditions may worsen and may bring the recurrence rate quite high. But of course now the vaccination, when you already have the cancer, may not serve any purpose.
All right, as we conclude on our conversation, you've talked about several treatment options available for all the stages of cervical cancer. Are all these available in the country?
Yes, they are. Okay. And I would advocate that we do not try and go out there to seek for other modalities. We have everything. We even have now doctors trained. We have gynecologists like myself trained. They are called oncogynecologists. They are quite a number now in the market, and therefore people do not have to go out there. All those modalities, starting from the surgical expertise, what we call colposcopy to look at the changes in the cervix, to those minor surgeries using radiotherapy or using the heat to try and chop the part of the cervix, the cone, coming all the way to chemotherapy. There are doctors available for chemotherapy. There are doctors available even for radiotherapy. The radio oncologists, they are all available in this country. I know sometimes it's a challenge. The government is trying. At the moment, I know it's only maybe Kenyatta National Hospital that may be able to offer this advanced radiotherapy. But now the treatment is available locally. Okay.
Yeah. All right. Thank you so very much for always sharing your knowledge right here on the show with us. We appreciate.
Thank you.
This is where we end this conversation. Thank you so very much for staying with us from the moment the show began until this point in time. On behalf of everyone who has made it a success, we say thank you and we wish you a lovely day. Goodbye.